What is nursing school like? I get this question a lot. What is nursing school like? If you're anxious, you feel like you've been accepted into nursing school, you're about to start, or you just got started. Like, what is nursing school like? What is nursing school like? So, welcome here. We talk everything nursing, and I'm here to teach you about nursing, tell you about nursing, and give you all the tricks that worked for me in nursing school as a single mother, and now as a nurse leader, as a supervisor, as a charge nurse, as a preceptor. So I'll tell you everything I know about nursing. So stay tuned, come back for more, and make sure you hit that follow button. So you've been accepted to nursing school. Congratulations. So this is your life for the 2 years or the 4 years in nursing school. So it's going to be fast, 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 fast. It's fast paced, it's nonstop. Okay. That's one thing that you have to know. Nursing school is nonstop, but it's a nonstop in a good way. I know that the adrenaline will be high, you'll be rushed, you're rushing for everything, you'll be stressed out, you will cry, you'll be happy, like you will have the extreme emotions in nursing school, just but it's for good. Let me tell you something, it's for good. If today they tell me to restart nursing school again, I'll do it again, over again. I don't mind, because the knowledge that I got from nursing school, I will go to my grave with it. Nobody will ever take that away from me, you know what I mean? So every day it's going to be reading. You will have your impossible books, okay? Impossible books. But every time I had to read these books, I was like, oh my God, I'm getting so smart. I'm really getting smart. So reading every day, assignments every day. Make sure you have your friends. You will have best friends in nursing school, because you'll be spending most of your time together. You won't have friends outside of nursing school anymore. You can't hang out. Everything you do, everything you think of is nursing school. It's for the good, because guess what? You're taking care of human beings, so you don't want to be making any mistakes or any errors. So yes, nursing school is for the good, and it's for the best. Okay, so think nursing every day, breathe nursing. So this is how it's gonna go. First day of nursing school, you will have meeting. I believe all of you guys that are starting that year will have a meeting together, and then professors, all of them, the the faculty members will come and introduce themselves and tell you about nursing, the passion, and how to get prepared, and what's ahead and everything. So you get to have your syllabus for your syllabuses for all your classes. So as soon as you get your syllabuses, make sure you get that planner out and you write down all your dates. Okay, so you will have lectures and you will have clinicals. Okay, so lectures, you will go for your fundamentals, for your communication. So it might be, let's say if you have 3 classes or 4 classes, 3 classes and a clinical. So you might have lectures for 2 days a week or 3 days a week, right? And then one day a week, you will have to go for your clinicals. So at the beginning, you will only do simulation labs. So you will go for your lab day at school with your teachers, your professors. They're going to teach you how to take manual blood pressure, how to inject an IV, how to read the medicine labels and all of that, how to clean a patient, all the basics of nursing that you do as a CNA and more. So you will learn that maybe the first month or the first 2 weeks. So you'll be at school learning, and then they have a dedicated lab where you go. It's like a hospital room or a hospital. So you have dummies, you have mannequins, you have the beds, you have everything. So you get to practice on everything that you are learning for your clinicals, and you have lots of professors there. That's what they do. They teach you things. They go over what you are studying in class with you. They're amazing human beings. They're so patient with us. I was such I couldn't understand and comprehend much of anything, just because not only nursing school is hard, English is not my first language, and then medical terminology is like Greek, right? So, but I found amazing people that were so nice and so patient with me, teaching me every day. So go with your study group, have a study group in nursing. That's the only way you get to survive nursing. Go with your study friends, just study, practice, practice, practice. So once you get into the hospital, you'll be comfortable, because you already practiced on the mannequins, on your friends. You can't kill the mannequins, but you can kill the human being. So practice is so important. So after practicing for a few weeks, then you get to go to the facility where you were assigned for clinical for that semester. So I had clinical every Wednesday. So every Wednesday I knew that I will meet with my group, with my clinical instructor. So yes, you get to meet at clinical at your location with your instructor and your classmates. They usually have you in a group of 5 students to 6 students maximum. So it's mixed girls and guys. So that's going to be your clinical group for the semester. It's going to be you. So before clinical, you have to make sure you have all your shots, your all um, your doctor appointment made, your physicals done. Have the school will ask you, will give you a list of things that have to be done before you go to clinicals. You will have your scrubs, your shoes, your uniform actually, and then make sure you have your backpack, your water. Make sure you have your lunchbox, or you can eat at the cafeteria during the break, and have a snack bar with you, because lots of people got, like, dizzy, sick, because they were too stressed, they did not get to eat, low sugar and all of that. So remember to have your coffee, of course, and have a snack bar, and just a little snack that you will keep in your pocket. So get all your clinical stuff ready, your stethoscope, your flashlight, your pens, your clipboard, your clinical pocket book, because you're gonna be working on your care plans after clinicals and everything. So once you get there, your professor will usually, if you meet at 6:30, your professor gets there at 5 something. So they look up the patients, they look up the nurses, and then they assign you to a nurse, and they ask you to, let's say if you're working on head to toe assessment, they'll ask you to do a head to toe assessment to demonstrate and to care, just to care, give water. At the beginning, you don't do much of anything, you just interact with the patient. You have to do your assessment always, right? Talk to the patient, know why they're there, do your head to toe assessment, and then, because you're going to go chart on your patient, you're going to document on your patient, you're going to do a report on your patient, and you have to do a care plan for your patient. Patient came for, let's say, diabetes, acidosis, so too much blood glucose in the blood. So for you as a nurse, what are you going to do? You're going to teach them what to eat and how to monitor the sugars, so it don't go that high. And also you're going to teach them proper care, when they are diabetics, sometimes they have the neuropathy, so they won't feel anything. Their feet, they have to watch their feet, for they have to watch out for wounds and all the good stuff. And you have to educate them about insulin management, and you have to educate them about nutrition. So that's your care plan that you're going to do after your clinical. So you see that you have clinical. After all, you will sit, you have a conference and talk about what went well and what did not go well, and what you learned and what you noticed. It's a lot of talking, because nurses, that's what we do. And after that, you go home and you get to work on your care plans, and the next day you have class. So that's that, guys, and that's a whole semester. Repeat, and then you won't have exams for clinicals, but you will have care plans to write, and that's, those professors don't play with the care plans. So care plans, you talk about the medicine this patient getting, patient education, patient care, and all the good stuff. And then for lectures, you will have exams, you have assignments, you have quizzes, you have group work, and all the good stuff. It's just like go 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 go. It's like military training, but it's for the goods, guys. And then that's that. Your semester will end. So my tips for you: stay organized, stay on top of your assignment, have a group study, have friends that are smart. Don't hesitate to reach out for help to your professors, to your friends. Go to the library, go find those tutors. They're there for that. Go to your open lab, go find those professors that will teach you stuff. They have so many. When I tell you, my techniques to give shots were so good, as if I've been a nurse by the time I graduated. It's just because I was hanging out there a lot with those people. They open until 8 p.m. So the days I don't have class, I'll just go there all day to study, practice, because practice makes perfect, right? So those are the tips that I have for you. And go see your professors during the office hours. Very important. It's going to help you a lot to learn about nursing, learn about how to study, what to study, and never hesitate to ask for help, because you cannot be a nurse by yourself. It's a village. It's a village, and those professors, some of them are really nice. Okay, so if you like these topics, if you like my channel, if you like my videos, don't hesitate to comment, to share, to like. That's the only way to show YouTube that you are liking my content, and they can push our content to more viewers, because I am a small creator, just started, so need all of you guys to be here and support, so I can create more quality content, teaching content about nursing. Stay blessed, follow, share, like, and stay blessed. Come back for more.